It can be easy to dismiss the early signs of a heart attack, as the symptoms don't always feel severe. It's never too early to call 999 and describe your symptoms.
Hello, my name's Mark Williams. I'm a consultant cardiologist. I specialise in coronary intervention, which is treatment of heart attacks and angina. I work in Surrey. So the main signs and symptoms of a heart attack include this feeling of unease, tightness of the chest, feeling breathless and sweaty. Some people might experience pain radiating up towards their neck or down their arm, and there may be associated nausea and vomiting. Oftentimes you have high blood pressure, but because you have no symptoms, no one pays notice to it until it causes a problem. So in the black population, hypertension, that's high blood pressure, is a common feature, and hypertension is one of the major risk factors for heart attacks or for coronary disease. So with hypertension or high blood pressure, most people don't have any symptoms at all. And that's why it's often called a silent killer, because you may have high blood pressure or stonking blood pressure, but because there's no symptoms, it's not recognized. So unless you routinely have your blood pressure checked, you'll never know that you're hypertensive, unless it then causes a problem. So the problem with high blood pressure is that it can cause end organ damage, so thickening of the heart muscle, stretching of the heart muscle, and ultimately heart failure. And that's when it's actually been there and not been treated. The other thing that's associated with the heart attack are strokes. So patients with heart attack with high blood pressure do suffer with strokes. And untreated hypertension can also affect your kidneys. So patients with high blood pressure can again develop kidney failure as a result.
The day I had my heart attack, I was driving back home from work and started to feel unwell. I had a mild pain in my chest and felt fatigue. My symptoms continued for a good half an hour, and at this point, I knew I was having a heart attack. I was surprised because I don't smoke and I don't drink. Acting quickly can help save your life and lowers the risk of long-term heart failure. Sometimes we're uncertain about our symptoms, but it's important to get a diagnosis to rule out any risk. My advice to others with any signs of a heart attack, including chest pain, squeezing or tightness across the chest, is to call 999 straight away.
In the recent NHS survey, it showed that almost 75% of Black people didn't recognize that there was a difference between a cardiac arrest and a heart attack. And in fact, almost 2/3 believe that a cardiac arrest was a different name for a heart attack, where in reality, they're actually two different entities. So a heart attack is where a heart artery, that's the arteries that supply blood to the heart, they're called coronary arteries. And a heart attack occurs when a coronary artery is blocked off or very narrowed. And as a result, there isn't sufficient blood getting to that part of the heart muscle. And as a result of not enough blood, oxygen isn't going to the muscle, and a muscle without oxygen dies, and that's what causes a heart attack. Whereas a cardiac arrest is where the heart suddenly starts to beat very erratically, and the most common cause is ventricular fibrillation, where the heart is beating so fast it's not sufficient time for it to fill or empty, and so the person actually loses consciousness. So in terms of high blood pressure is the silent killer. And so as one gets older, I think you should have your blood pressure checked at least to start with once or twice a month. And if it is fine to be elevated, then more frequently. And it may be that you need to start medication. And once medication is started, to stay on that medication. The other thing you can do, many people now purchase their own blood pressure machines, and you can record your blood pressure at home. Because oftentimes, people go to the GP, have the blood pressure checked, and it's recorded as high, and there's something called white coat hypertension. This assumption is, the blood pressure is high because you're at the GP surgery. But if you have your own monitor, then you can monitor it in the comfort of your own home. And if it's found to be elevated, then act on it. I mean, I often recommend, if you're going to monitor your blood pressure, do it twice a day, morning and evening. You can take more than one reading at each time, because sometimes the first reading that you do is high. But you can do another reading and get an overall record of what your blood pressure is. And as I said, if it is high, then seek further attention, because it may be that you need to start some treatment. The vast majority of people who do have high blood pressure, you don't find an underlying cause, and it's what we call essential hypertension. Or 95% of people who do have high blood pressure have what we call essential hypertension. So there is an underlying cause. But in a small 5% percentage, you can actually find an underlying cause, and if the underlying cause is treated, then you cure the blood pressure. And so, as a specialist, if someone comes to me with high blood pressure, depending on their age, I would investigate for underlying causes, and of course, then start treatment. And individuals can get a cardiac arrest as a result of a heart attack, because if a major area of the heart muscle is affected, i.e. via the blocked artery, then they can also have a cardiac arrest. But they are two distinct conditions. Well, in my experience, we've seen heart attacks in people above 40, up to 80 and above. So, it's not something that should be ignored. Someone gets chest tightness, so you start developing chest tightness or pressure on the chest. You shouldn't ignore it. And I think what often happens is that people think, oh, I'm too young to have a heart attack. It can't be that. It must be something else. And unfortunately, don't act on it, and the damage is done. So first of all, if you start to develop chest pain and you're concerned that this may be a heart attack, the first thing is not to ignore it. And my first point of call would be to call 999 and speak to someone from the ambulance service, because it's something that is easily treatable, but if not treated, can cause a major problem. So I wouldn't actually wait around to call the GP. I would go for 999 in the first instance. So if you require further information about heart attacks or what we're talking about today, you can go to www.nhs.uk/heart attacks.
It can be easy to dismiss the early signs of a heart attack, as the symptoms don't always feel severe. It's never too early to call 999 and describe your symptoms.